Good oral health is an essential part of our overall well-being. Very good evening, viewers. Welcome to yet another episode of BMC Global Live AL-HILAL Health World, nothing but lifestyle. This is an exclusive health talk with doctors from AL-HILAL Hospital and Medical Center. Myself, Marina Francis. So in today's episode of Health World, we are taking up the topic pregnancy and oral health care. Let us know from the doctor joining with us how pregnancy is going to affect the oral health care. So before that, let me welcome to you the doctor joining with us today, Dr. Bindiya Sajan.
Thank you.
She is a general dentist with over 16 years experience in Bahrain. She is currently working at AL-HILAL Hospital, Adliya. She is also a singer, having performed in many live shows in Bahrain. So let us move ahead with today's discussion on the topic pregnancy and oral health care. Good evening, doctor.
Good evening, Marina.
Welcome to Health World episode. Thank you for joining with us. Doctor, we have taken up the topic pregnancy and oral health care. So firstly, let me ask, how does pregnancy affect oral health?
Pregnancy is a unique period in a woman's life which is characterized by complex physiological changes which may adversely affect the oral health.
Okay.
Due to a surge in hormones during pregnancy, the gingival tissues or the gum tissues exaggerate an abnormal reaction to plaque. Plaque is a colorless, sticky, thin layer of bacteria that adheres to the tooth surface if food debris is not cleaned thoroughly. This plaque, if not removed daily, could harden into tartar, which is the main cause for all the dental problems such as gingivitis, periodontitis, dental caries, etc., worsening over time.
Okay.
Untreated dental infections could result in poor health outcomes both for the mother and the baby. So, oral health during pregnancy should be considered an integral part of prenatal care.
Okay. So, doctor, you told about the importance of dental care during pregnancy. So, what could be the common cause of dental problems?
Due to the effect of pregnancy hormones such as estrogen and progesterone, pregnant ladies tend to bleed readily and may consequently avoid brushing their teeth. As a result, bacterial plaque accumulates, leading to gum diseases and cavities.
Okay.
Vomiting is another common cause that causes dental problems. Pregnancy hormones soften the ring of muscles which keep food inside the stomach. Gastric reflex, that is regurgitation of food and drinks, or the vomiting associated with morning sickness, can cause the teeth to be covered with strong stomach acids. Okay, so these acids, can cause a condition called as tooth erosion, where the enamel layer gets worn off, resulting in increased risk for decay.
Okay. So, doctor, what can we do to prevent in that?
Yeah, some suggestions if you have constant vomiting, avoid brushing your teeth immediately after you vomit. Okay, because when the teeth are covered with strong stomach acid, brushing actions can further damage the teeth. Okay, so you can rinse with plain tap water and follow up with a fluoridated mouthwash.
Okay.
Another common cause is cravings. Some pregnant women have unusual cravings for sugary snacks especially, which is the main culprit for dental caries. Okay, so avoiding sugary snacks is important, but if you have too much craving for sugary items, you can try to use food in low in added sugar, and choose healthier options such as fresh fruits, and brush your teeth after you have something sugary. Next is gagging. Some pregnant women experience gagging while brushing their teeth, especially the backside. However, it is important that you brush all the teeth surfaces in order to avoid teeth damage. So, what you can do is use a brush with a small soft head so that it reaches the back teeth. And go slow when you brush. Take your time. And if the taste of the paste causes you to gag, you can switch on to another brand.
Okay. So, doctor, you spoke about the causes. So, what are the oral changes that occur during pregnancy?
The most common oral change is seen in the gums, a condition called as gingivitis, that is sore and bleeding gums.
Okay.
This is due to increased levels of progesterone in the bloodstream, which causes the blood flow, increased blood flow to the gums, resulting in sore and bleeding gums. Pregnancy gingivitis starts at around second month of gestation and reaches its highest level during the 8th month.
Okay.
Gingival hyperplasia, that is an abnormal overgrowth of the gingival tissues. This is another finding. Periodontitis. Periodontitis is the infection of the supporting structures of the tooth.
Okay.
It's caused due to untreated gingivitis and may result in loss of teeth.
Okay.
Another common finding in pregnancy is pyogenic granuloma, also known as pregnancy tumor. It is not a true tumor, and it is seen as a red round growth in your gingival tissues and could bleed easily. Small lesions usually regress after delivery, but larger lesions which are interfering with your function or those that are causing problems with occlusion need to be removed surgically.
Okay.
Surgical excision can be done either by the conventional methods or by laser treatment.
Okay.
Mouth ulcers. This is another common finding in pregnancy. It's usually found in your inner cheeks, lips, tongue, etc., and may cause pain or irritation.
Okay.
These are some of the oral changes associated with your gums. Coming to the teeth, the most common finding is dental caries due to the sudden change in eating habits and decreased salivary flow.
Okay.
Another finding is erosion, as mentioned earlier. It's caused due to the acid attack from vomiting.
Okay. So, doctor, does pregnancy take calcium from your teeth?
It is a myth that calcium is lost from the mother's teeth during pregnancy. The calcium your baby needs is provided by your diet, not from your teeth.
Okay.
So make sure you get adequate amounts of calcium from your diet. You can do this by taking at least 3 servings of dairy products per day.
Doctor, another doubt is that these dental problems, does it affect the developing baby?
Yes. Research has found a strong link between severe gum disease and premature birth of babies with low birth weight.
Okay.
Babies born prematurely are at increased risk for developing breathing problems, cardiac issues, brain injury, and problems with eyesight and hearing. It has been suggested that 18 out of every 100 premature births could be linked with severe periodontal diseases.
Okay.
And oral infections could trigger the production of pro-inflammatory mediators which act as risk factors for even miscarriage.
Okay. So, we have only dealt with some of the common dental health problems as well as what could cause such problems. We need to know what we should take care during pregnancy regarding oral health, but we will be back after a very short break. Stay tuned. Welcome back. You're watching BMC Global Live AL-HILAL Health World, nothing but lifestyle. Today's topic for discussion is pregnancy and oral health care. So let us proceed with the further questions. So doctor, a common doubt that everyone has is what could be the safe period when we can take dental treatment during pregnancy?
The most appropriate and the safest period to perform any elective dental procedures is during the second trimester, that is 13 to 26 weeks.
Okay.
Those conditions which cannot be postponed until the end of delivery, such as an infected tooth extraction or a root canal treatment or even a filling, can be safely performed during the second trimester.
Okay.
Effective dental treatments is best avoided during the first trimester because it's a very sensitive period. It's a stage where organogenesis takes place, that is the baby's organs are being developed during this stage.
Okay.
But if you have an acute infection or swelling, severe pain, or a condition where delaying the dental treatment could cause you more harm, then immediate dental treatment has to be performed with the consent of your consulting obstetrician.
Okay.
The same goes for third trimester. Unnecessary intervention by a dentist is not recommended unless it is an emergency.
Okay. So doctor, what could be the importance of nutrition in our dental health?
Yeah. Adequate intake of energy and nutrients constitutes positive health benefits, whereas inadequate intake affects the mother and baby negatively. The purpose of nutrition in pregnancy is to balance the body's nutritional requirements as well as to provide the essential energy and nutrition required for the developing fetus.
Okay.
Baby's teeth development starts at 5th and 6th weeks of intrauterine life.
Okay.
So during this period, the mother requires 1200 to 1500 milligram of daily calcium for herself and for the baby's teeth and bones to be healthy.
Okay. So doctor, you spoke about the importance of nutrition during pregnancy. So can you give us some dietary guidance that can be followed during pregnancy?
Yeah. Increasing your vitamin D and calcium is necessary to protect your teeth and bones and to meet the requirements of your developing baby. Fresh fruits, vegetables, fish, meat, eggs, milk and milk products, some nuts like almonds, all these should be included as part of your balanced diet to provide vitamins such as A, D, C, calcium, phosphorus, etc. The effects of vitamin A and D in enamel formation is well known. Vitamin D helps to utilize calcium from your body. Small amounts of sun exposure help supporting vitamin D levels.
Doctor, does any habits during pregnancy affect the oral health?
Yes. Nicotine and alcohol consumption. Smoking is a deleterious habit which can affect negatively the oral health, especially your gums.
Okay.
Periodontal inflammation and destruction very common in smokers. Due to the anemic effect of smoking, wounds in the mouth recovers very slowly and spontaneous bleeding can be seen.
Okay.
There is an increase in number of the papillae of your tongue which results in a condition called smooth tongue that makes oral hygiene very difficult. Smoking has direct toxic effects. The carbon monoxide present in 4% of cigarette smoke is known to reduce oxygenation to the fetus by binding to the hemoglobin in red blood cells. Okay. So, smoking is very bad, especially in pregnancy. Even alcohol consumption has a negative effect on oral health.
Okay. So doctor, we dealt with many aspects in this episode. So in total, how to take care of dental health during pregnancy? Your advice?
Being pregnant comes with a lot of responsibilities.
Yes.
And taking care of your teeth is no exception.
True.
Some guidances which you can follow while you're pregnant especially is reinforcement of your routine oral hygiene maintenance by brushing your teeth twice daily, preferably with a fluoridated toothpaste, flossing between your teeth once daily.
Okay.
If you need help with plaque control, rinsing at night with an antimicrobial mouth rinse is recommended, but avoid alcohol containing mouthwashes during this period.
Okay.
Alternatively, you can use warm saline gargle to bring down the inflammation of your gums. And very essential is eating a balanced diet rich in fruits and vegetables. Avoid carbonated beverages, sticky chocolates, toffees, dry fruits, etc. And try avoiding sugary snacks. Even if you snack, do so in moderation.
Okay.
And visit your dentist for a professional cleaning at the dental office.
Okay.
For most women, routine dental visits to the dentist is safe during pregnancy, but let the dental office know which month you are in when you make an appointment.
Okay.
If yours is a high risk pregnancy or if you have any particular medical condition, inform your dentist about it. He may postpone the dental treatment and give you medication. Also, if you are taking any particular medications or you have any special advice from your gynecologist, let the dentist know about it.
Okay.
And any changes in your gums such as swelling or bleeding, inform the dentist about it.
Okay.
The benefits to receive dental care far outweighs the potential risks.
Yes. So doctor, before we wind up today's episode, any final note to our viewers?
Studies have shown that healthy gingiva remains relatively unaffected during pregnancy. So some small precautions and care taken during or before pregnancy helps avoiding irreversible dental problems.
Thank you very much, doctor. Thank you so much for answering to all our queries and coming here and joining with us today.
Thank you, Marina. Thank you. Thanks a lot.
So I definitely hope that this episode would have been a very informative one for all of you viewers. As doctor said, yes, preventing a problem is much better and easier than trying to cure it. So all of you, please do take care of your health. We will meet again. Until then, this is Marina Francis signing off. Stay tuned to BMC Global Live for more such informative episodes. Keep smiling, keep spreading smiles. Good night.